Hello, it's me again, Sarah Agalar. Today we'll discuss with you the third lecture. The topic of our lectures is upper airways physiology and pathophysiology, importance, normal nasal breathing in airway disorders, rhinitis, classification of the rhinitis, about the rhinosinusitis, the classification, etiology, diagnosis, treatments, Epistaxis, trauma of the external nose, septal deviation, hematoma, and abscess. We know that the nose consists of the external nose and nasal cavity. The nasal cavity is extend from the nostrils in front to the posterior nasal apertures, choana, and choana opens into the nasopharynx. Vestibule is the area of the nasal cavity lying just inside the nostril, and it's divided into the right and left halves by the nasal septum. The mucosa lined with respiratory mucous membrane, except the vestibule, is lined with modified skin and has coarse hairs. And secondly, it's above the superior concha, is lined with the olfactory mucous membrane and contains nerve endings. The nasal cavities has 5 functions. The respiratory functions, we see with the respiratory function we are breathing. The olfactory function, in the superior part of the superior turbinate, there is the nerve endings on the nasal membrane, and the smelling, it acts as a smelling. The vocal resonance and defense, the protection of the lower airways by the mucociliary clearance and filtration. Air conditioning of inspired air. The inspiratory and expiratory air currents during quiet respiration pass between the turbinates and nasal septum. Little air passes below and above the level of the turbinates, and sniffing helps the weak odorous substances reaching olfactory area. Air conditioning of inspired air function. We know that the nose acts as an air conditioner filters and purifies, moistens, and warms the inspired air for lungs. In 24 hours, we breathe in 500 cubic feet of air, and air is efficiently filtered, humidified, adjusted to proper temperature, and cleared of all the dust, bacteria, and viruses by the nose. The filtration purification function, it has the temperature control and the humidification. About the filtration, the nasal vibrators plays the big role. The nasal vibrators filter coarse particles, but the smaller particles pass through the nose into the lower airways. The temperature control functions is acting by the radiator mechanism. We know the turbinates double the surface area of the nasal mucosa. The large surface of the nasal mucosa is structurally adapted to regulate temperature of the inspired air. The mucous membrane of the middle and inferior turbinates and adjacent part of the septum controls the blood flow that regulates the size of the turbinates. This radiator mechanism warms up the inspired cold air to near body temperature, and hot air is cooled to the body temperature. The humidification function, the serous glands of the nasal mucous membrane regulate the relative humidity of the inspired air, which is dry in winter and humid in summer. The protection of the airway, and this function is act with the enzymes and the immunoglobulins. Enzymes and immunoglobulins are present in nasal secretion, and with interferon provide immunity against upper respiratory tract infections. The olfaction function is very important non-biological function. Olfactory system is highly developed in animals, and it's important for their communication and survival and gives warnings of the environmental dangers. In humans, it's comparatively less developed but plays an important role in enjoying delicious and sumptuous food. The olfaction also sometimes is disturbing. It's disturbing during the upper respiratory viral infection, during the idiopathic after the head trauma, obstructive sinonasal disease, neurological, psychiatric diseases, intracranial neoplasms, and toxic chemicals with Surgical trauma also can lead to just olfactory disturbance. And olfactory disorders also classified as the conductive, sensorineural, and central neural loss. In this slide, you can see the olfactory dysfunctions. Okay, the vocal resonance, it is this function. The nasal cavity is the third most effective resonator. Nose acts as a resonating chamber for the speech. The nasal reflexes shows is as sneezing or cardiopulmonary responses, appetite, and the nasobronchial and nasopulmonary reflexes. How happens the nasal congestion? The inferior turbinates are lined with a cavernous mechanism that responds readily to various types of allergic, non-allergic, and physical stimulation. In response to inflammatory mediators such as the histamine, this mucosal tissue undergoes rapid and robust vasodilatation, leading to turbinate congestion and nasal obstruction. Okay, one nasal organ of Jacobson organ, it is the rudimentary organ. We should have the information about that because it's sometimes rarely it's situated 1 centimeter behind the caudal end of the septum and 3 millimeter above the nasal floor. We call the inflammation of the nasal mucosa rhinitis. The rhinitis is divided acute and chronically. The acute rhinitis also may happen as a coryza and infections. Chronically, they consist of include the catral, hypertrophic, hyperplastic, atrophic, subatrophic, Ozena, and the vasomotor rhinitis. And vasomotor rhinitis also divided allergic and neurovegetative rhinitis. This classification we demand on you in our exam, in our program, and we have another classification also. It is which generally accepted in the West world. The rhinitis is divided allergically and non-allergically. The seasonal allergic rhinitis or hay fever and perennial allergic rhinitis include two allergic rhinitis, and non-allergic rhinitis include the irritative, toxic occupational, hormonal rhinitis, drug-induced, idiopathically vasomotor, non-allergic rhinitis with eosinophilia. The international classification code of the acute rhinitis is G00, and we can indicate this code to this name, to this term. Rhinitis, also known as a coryza, is irritation and inflammation of the mucous membrane inside the nose. The common symptoms are stuffy nose, runny nose, sneezing, and postnasal drip. Acute infectious rhinitis also may happen as a viral, bacterial, and irritative. The pathology of the viral rhinitis, the viral infection of the nasal mucosa leads to acute generalized hyperemia of the nasal mucosa, and it leads to engorgement of the secretory gland and goblet cells and profuse secretion involvement of the sinuses may happen. Stages of viral rhinitis, we know that it has just the incubation period, it lasts just 1-3 days. There are 4 stages of the clinical stages of viral rhinitis, and there are 3 pathogenetic stages of viral rhinitis. The clinical stages, the first stage is the ischemic stages. During the ischemic stages, the itchings is the symptoms of these hyperemic stages. During the hyperemic stages, the clinical feature is the serous rhinorrhea. The secondary inflammation is our third stages. It acts as the show is itself purulent rhinorrhea and resolution. It's the last stages. The pathogenetically, it has the 3 stages. The first is we call this the reflector or prodromal. The second is the catral and serous, and the Third one is the bacterial and purulent. The viral rhinitis, the common cold, which we call the Osakarisa, the etiology is caused by the virus usually through airborne droplets. The adenovirus, picornavirus, rhinitis virus, today so very popular coronavirus also is the reason of the common cold. The incubation period, we said, it lasts just 1-4 days, and sometimes the illness lasts for 2-3 weeks. The clinical features of viral rhinitis: the burning sensation of the nose followed by nasal stiffness, rhinorrhea and sneezing, low-grade fever, nasal discharge is initially watery and profuse but may become mucopurulent due to secondary bacterial invasion. The treatment of this is the bed rest, plenty of fluids, antihistamine and nasal decongestant, and analgesics to relieve for headache, and antibiotics if secondary infection is happening. The complication may, as a disease is usually self-limiting and resolves spontaneously after 2-3 weeks. Occasional sinusitis, bronchitis, pharyngitis may occur as a complication. The influenza rhinitis caused by the influenza viruses A, B, or C, and rhinitis associated sometimes with the exanthemas. The measles, rubella, chickenpox are often associated with rhinitis, which precedes exanthemas by 2-3 days. It's the treatment of the viral rhinitis. About the bacterial rhinitis, it may be as a non-specific infection and maybe as a secondary bacterial rhinitis. The non-specific infection, it may be primarily or secondarily. The primary bacterial rhinitis is seen in child usually infected by the pneumococcus, streptococcus, or staphylococcus, and grayish-white membrane may form in the nose, which with a temperature will cause bleeding. Also can occur. The second bacterial rhinitis is a result of the bacterial infection supervening acute viral rhinitis. About the diphtheric rhinitis, it's also a bacterial rhinitis. It's also may happen as a primary and secondary to the social diphtheria. May occur in acute or chronic form. The grayish membrane is seen covering the inferior turbinate and the floor of the nose. Membrane is tenacious and its removal causes bleeding. The treatment is the isolation of the patient, and cysteine, penicillin, and diphtheria's antitoxin is very important. What's the irritative rhinitis? It's irritative rhinitis after the exposure to the dust, smoke, and irrigating gases like ammonia, formalin, and each others. May result from trauma on the nasal mucosa during the intranasal manipulation. The clinical features of irritative rhinitis are immediate casual reaction with sneezing, rhinorrhea, and nasal congestion. Symptoms may pass off rapidly with removal of offending agent. About the chronic rhinitis, it is the chronic inflammation of the nasal mucosa. We call the chronic rhinitis. There are so many classification systems, but this classification is the prevalence classification system, also which we demand on you during the exam. The chronic rhinitis divided as a casual or simple, hypertrophic, vasomotor, and atrophically. The hypertrophic also divided limited and diffuse. Hypertrophic, vasomotor as allergic and neurovegetative, and atrophic rhinitis divided to simple and Ozena. The chronic simple rhinitis, this picture we want to show you and it's the endoscopic view of the nasal mucosa and nasal turbinate. Recurrent attacks of the acute rhinitis in presence of predisposing factors leads to chronicity. Which predisposing factors? We mean persistence of nasal infection due to sinusitis, tonsillitis, and adenoids, chronic irritation from dust, smoke, and each other. Nasal obstruction due to the DNC synesthesia leading to persistent discharge. The pathology, there is the hyperemia and during the endoscopy, we will see the hyperemia and edema of mucous membrane with hypertrophy of seromucinous glands and increase in goblet cells. Blood sinusoids over turbinates are distended. That's why the clinical feature is the nasal abstraction, which we can see on the pictures. Also, the nasal discharge, headache, swollen turbinates, swollen turbinates, and postnasal discharge. During the treatment of chronic rhinitis, we should eliminate the causative agent. The nasal irrigation solution help it. This nasal decongestant help to relieve the nasal obstruction and improves the sinus ventilation. A short course of systemic steroids helps to when patient already addicted to excessive use of decongestant drops or sprays, and sometimes we need to use its indication they're using the antibiotics. During the hypertrophic rhinitis, it's characterized by thickening of the mucosa, submucosa, seromucinous glands, periosteum, and bone. Changes are more marked on the turbinates. The etiology of hypertrophic rhinitis is the recurrent nasal infections, the chronic sinusitis, chronic irritation of nasal mucosa due to smoking and other irritations, and prolonged use of nasal drops and vasomotor and allergic. The rhinitis also has the etiological factors of hypertrophic rhinitis. The symptoms of hypertrophic rhinitis, the abstraction is main symptom, the nasal discharge is thick and sticky, headache and chest and anosmia. This happens during the anterior rhinoscopy. We can see the hypertrophy of the turbinates. The turbinate mucosa is thick and does not fit under pressure. And the treatment of the hypertrophic rhinitis, we should first is to discover the cause and remove it, and the nasal obstruction can relieve by reduction in size of turbinates by various methods. What's the atrophic rhinitis? It is the chronic inflammation of nose characterized by atrophy of nasal mucosa and turbinate bones. The nasal cavities are roomy and full of foul-smelling crusts. There are two types of atrophic rhinitis, the primarily and the secondarily. During the primary atrophic rhinitis, the hereditary factors, endocrinal disturbance, the racial factors, nutritional deficiency, infective and autoimmune process is the etiology of atrophic rhinitis. The pathology during the biopsy, even we can see there is absence of the cilium. The ciliated column rectilium is lost and is replaced by stratified squamous type. Atrophy of seromucinous glands and venous blood sinusoids and nerve elements. The turbinate undergoes resorption of causing widening of nasal chambers. The symptoms is the common in females. It happens during the puberty period. Foul smell from nose, but patients remains unaware. Marked the anosmia, nasal obstruction in spite of wide nasal chambers due to large crust formation, and sometimes epistaxis occurs. Primary atrophic rhinitis and secondary atrophic rhinitis leads to cholestasis, bone resorption, progressive atrophy, and epithelial destruction. During the Ozena, it is the etiological factor, it is the Klebsiella ozena. There is the superinfections, but we cause the specific atrophic rhinitis. But atrophic rhinitis maybe as an empty nose syndrome, which happens during the developmental countries related with the popular insurance program is during the surgically so aggressively. The absence of identifiable turbinates on sinus during the CT we can see. And the secondary atrophic rhinitis is a result of chronic sinusitis or excessive surgery to the nasal turbinates. It is the empty nose syndrome. We mean it's the iatrogenic, it's the debilitating the nasal disorder, which occurs when the nasal airway passages have been overly enlarged in operations known as turbinectomies. These operations involve significantly reducing the size of the inferior or middle turbinate of the nose. and extensive surgery of the nose. Even in the CT scan, we can see just the middle inferior turbinate just completely resected. Rhinitis sicca. We said that it's the types of the rhinitis sicca and rhinitis causosa also may accuse. It's also a crust-forming disease seen in patients who work in hot, dry, and dusty surrounding. For example, Baker's iron and Goldsmith's conditions is confined to the anterior side of the nose, particularly of the nasal septum. Here, the dilated colorectal undergoes squamous metaplasia with atrophy or seromucinous glands. Crust forms on the anterior part of septum and their removal causes ulceration and epistaxis and may lead to septal perforation. What's the rhinitis causosa? It's an uncommon condition, usually unilateral and mostly affecting males. Nose is filled with offensive pulmonary discharge and cheesy material. The disease possibly arises from chronic sinusitis with collection of inspicited cheesy material, and the sinus mucosa becomes granulomatous. Bony walls of sinus may be destroyed, requiring differentiation from malignancy. The treatment of it is removal of debris and granulation tissue and free drainage of the affected sinus. The prognosis is good. The current therapies of all the atrophic rhinitis, it's the goals of the therapy. They restore the nasal hydration and minimize crusting and debris. The treatment options, there's the topical therapy, saline irrigations, the antibiotic irrigation, systemic antibiotics, implants to fill the nasal volume, and closure of the nostrils. When we mean the local therapy, we mean just the irrigations, the anti-drying agents, and others. When we mean the systemic therapy, it includes the oral antibiotics, medication avoidance, and other. We mean just some elements which needed, and the vaccine sometimes is indication. The surgical therapies, these are the young procedure, modified young procedure, turbinate reconstruction, volume reduction procedures, non-wetting operations. It's doing after the atopic rhinitis. Allergic rhinitis is an inflammation or irritation of the mucous membranes, the lines of the nose. An allergy occurs when the body reacts to substances like tree pollen or dust mites, are called the environmental antigens or allergens, and are normally harmless, but the immune system of a person with allergies views the allergens as harmful. Allergic rhinitis also divided as a hay fever and perennial. Hay fever, it is the seasonal allergic rhinitis, and perennial, it happens, the symptoms is valid all year. These are the allergic rhinitis, popular allergic rhinitis symptoms. We see the red and itchy watery eyes, the sneezing, congestion, the runny nose, itchy ear, sore throat, postnasal drip, cough, and the fatigue. The type that occurs during only the spring or summer, we call these the seasonal allergic rhinitis, the medical term for hay fever. During the allergic rhinitis, in that slide, we can see the normal nasal mucosa and the normal nasal paranasal sinus mucosa also. And during the allergic rhinitis, we can see the inflamed nasal mucosa and the inflamed nasal mucosa in the paranasal sinuses. In that patients, it's the typical symptoms of allergic rhinitis. The red, itchy, watery eyes, the sneezing, congestion, the runny nose, and itchy or sore throat, the postnasal drip. The most common causes of hay fever are the tree pollens such as helder and hazels, and especially birch. It happens during the spring, and we call this the spring hay fever. The grass pollen is etiological factor of the summer hay fever. Negroid and hybrids such as the chrysanthemum, it is valid during the autumn. What can cause the hay fever? We know that the genetic predisposition associated with other atopic diseases, for example, the eczema or asthma. Hay fever sufferers are more vulnerable to other allergic respiratory diseases, for example, asthma and sleeping difficulties that can lead to chronic fatigue. Even in that picture, we can see the problems relating to the allergies. Perennial allergic rhinitis is a similar allergy that occurs all year round and is caused by things such as the house dust mites, pests, and mold fungus. And the symptoms often come and go, and sufferers may think they are getting frequent colds, the medical term for which is viral rhinitis. The allergic rhinitis is a common allergic reaction that causes inflammation in the lining of the nasal mucosa. We can see the nasal lining appears pale, the boggy blue. It's the characteristic view of the allergic rhinitis. During the non-allergic rhinitis, it's inflammation in the lining of the nose that is not caused by an allergic reaction. During the nasoscopy, anterior rhinoscopy, and endoscopic view, we can see the swollen and inflammatory nasal lining, the nasal postnasal drip, and the nasal discharge. Non-allergic rhinitis includes inflammatory rhinitis, such as non-allergic rhinitis with eosinophilia syndrome, and infective rhinitis, and non-inflammatory rhinitis, such as the vasomotor rhinitis and idiopathic, which we call this the idiopathic rhinitis. Allergic rhinitis is diagnosed based on the presence of allergen-specific IgE and the documentation of relationship between the allergen and symptoms in patients with typical rhinitis symptoms such as rhinorrhea, nasal obstruction, itchiness, or sneezing. In that diagram, we can see just the typical nasal symptoms, the sneezing, rhinorrhea, nasal obstruction, and itching. Because these symptoms occurs and during the allergic and non-allergic rhinitis. But when in the skin prick testing is positive, we call this the allergic rhinitis. When it is negative, we call it non-allergic rhinitis. The rhinitis with negative skin test, some patients have all the symptoms of the nasal allergy, but the standard allergy test proved negative. In the past, it was convenient to refer to this condition as non-allergic rhinitis, also in view of recent developments, suggesting that many of these cases may turn out to be due to a type of allergy. After all, the alternative name, idiopathic rhinitis, is probably better. Idiopathic simply means that the causes are at present unknown. Even in that table, we can see the difference of the allergic and non-allergic rhinitis. And during the non-allergic rhinitis, you can see there is the one set of symptoms later in life, but during the allergic rhinitis, it's the usual presence in childhood. Perennial symptoms in nature with very little seasonal variation, but during the allergic, most have seasonal exacerbation of symptoms. During the non-allergic, negative are allergen skin testing, and or serum IgE testing. But during the allergen test, allergic rhinitis, all this test is positive. In that slides, we can see the pathological change in non-allergic rhinitis. When irritants exposure, the replacement of ciliated epithelial cells by goblet cells, and that's why it leads to mucin hypersecretion and decreases the mucociliary activity. The classification of non-allergic rhinitis. Non-allergic rhinitis was broadly divided into five subgroups, in which we say the irritative or toxic, the hormonal rhinitis. It sometimes happens in a pregnant woman, the drug-induced rhinitis, which used so many times just the nasal sprays, decongestants, idiopathic with Vasomotor rhinitis, and other forms, non-allergic with eosinophilia. The Vasomotor rhinitis, it's the heterogeneous group, not immunologic or infection in origin, and is usually not associated with nasal eosinophilia. Rhinorrhea enhances cholinergic glandular secretory activity. Even if we can see, and we have just the endoscopic view of the vasomotor rhinitis. The non-allergic rhinitis with eosinophilia who demonstrated the lack of evidence for allergy on skin testing or in vitro testing for specific IgE and who had greater than 20% eosinophils on nasal smears. That the condition was first described as a discrete entity in 1981. Also, the etiology of nevus is not known. Many of its clinical characteristics are seen among the patients with Sanders triad, who has at the same time aspirin sensitivity, asthma, and the nasal polyposis. The diagnosis of this is very important. The history, the physical examination, nasal endoscopy, allergy testing, skin testing, in vitro testing, nasal cytology, and the nasal challenge. In that picture, in the slides, we can see the skin prick testing, this helps to confirm the causative allergen and the results are immediately available, showing the patient the will and flare reaction is a useful way of demonstrating to the patient the inflammatory nature of allergic rhinitis. The treatment of allergic rhinitis, the first is very important, the education of the patients, then the allergen avoidance pharmacotherapy, antihistamines, decongestants, mast cell stabilizers, corticosteroids, leukotriene modifiers, topical anticholinergic sprays, anti-IgE, immunotherapy, and surgery is very important.